I would like to think that all of you are going to behave like that with everything I teach you, like, probably not. But there was one student I had, Mario, at a different school. First day of class, front row. No one sat with him. Had all of his pens out, different colors, highlighters, book open, ready to go. Everything I taught him, every single day, he always said the same thing to me, every time. And it was this, excuse my language, no fucking way. No way. And I go, yes, Mario, yes. Trust me, this is, imagine how he responded when I finally got to female anatomy. Spread eagle shot. And I was like, in this order, get it straight. Clitoris, urethra, vagina, anus, in that order. Figure it out. Make sure you know your holes. Same response. And then he said, I'm going to go home and show Veronica. I'm going to get a mirror and I'm going to show her. And I said, I'm fairly certain your girlfriend knows. But she will be thrilled now that you do. Yeah.
Go get her.
First day of class, no one sat with him. I think I know why. After class was over, cleaning up, we teach! Oh, Mario. So he said, everything was F-bomb, okay? You don't know who the fuck I am, do you? And I went, a human? What else? You don't know what all these tattoos mean, do you? But no, I went to a private all-girl Catholic high school. No, I don't know what that means. I really don't. I'm Sister Mary Cara. He did some bad things. That's why most of the students would not sit next to him. He looked threatening. A few class times in, everything, no. They loved him because he was like a 3-year-old. Just, he had left gang life to pursue being a nurse. He was tired of taking lives and wanted to save them. Unfortunately, because of his criminal behavior, his background check, he did not clear that. He was devastated. I'm going to go back to the game. Go back to my game. No, you're not. You're better than that. You're educated now. You can find something else to do. Teach! I said, yes, you will. Find something else you can do. Every once in a while, when I'm at the gym, pounding out my miles, every once in a while I see him on the TV screen, usually running from a cop. He's an actor playing a gang guy. It's perfect for it. He's got the tattoos and everything. Every once in a while I see him on some random crime show. I'm like, there's Mario running from the cops. He does it well. Seriously. Next time I see an episode, I'll tell you which episode it's on. Brilliant, don't you think?
Yes.
Recreated himself. So, okay, you're not Bethany, you're not Mario, but I hope to at least keep you entertained with some stories. Because anatomy is kind of boring. You're not going to just learn anatomy in this class. Sorry, it's boring. That's the morphology. If we say with form comes function, you're also going to learn to recognize a form of something and then be able to predict what it will do in the body. With form comes function. Its function is the physiology. And yeah, you're going to get some physiology in this class. You will also get some pathophysiology, because isn't that why you're here? You're here because you have this idea that you can help people. I mean, who here is an auto mechanic? Right, like Sean Millay. Who here wants to be a nurse? PA, PT, OT, dental hygienist, MD, rockin' hot scientist. What else? What am I missing? Dietitian. Any dietitian wannabes? So you're here for some sort of clinical aspect. Arguably, people don't go to the hospital because they're fine. No one shows up saying, I just feel like having lunch in bed. Arguably, the person closest to that scenario would be a woman terminally pregnant with a parasite. Relatively healthy scenario, right? But most people don't show up just going, I feel fine, actually, so admit me. No, they're going to be in a disease state. You got to figure out where they are in that progress, that continuum of disease state. How much is their body still trying to do for them? How much do you need to intervene medically? But one of my favorite lectures I give in pathophysiology actually comes from another professor, Dr. Minarsik, and he says, every single diseased state will have a change in the anatomy. Every single one. That's one of the characteristics of disease states. The anatomy changes. And he says it might not be on a macroscopic level. It might be on a histological level. Microscopic. But the change in the morphology is there. And he's a pathologist, so he knows. He knows how to look at slide after slide after slide, and he can tell you this person has this disease just by looking at their cells. That's pretty amazing, I think. When I took anatomy in the medical school, we learned anatomy by regions. We started with the back on our cadavers. And that meant when we studied the back, I had to know all the bones of the back. I had to know all the muscles, all the nerves, all the blood vessels. That was a lot of work to piece all that together. That's not what we're going to do. We're not going to do this regional anatomy approach. We're going to do a systems approach. So you're going to start out with bones, cartilage, muscle, and we move on from there. Lecture Unit 1 is really boring. It really is. It's cells, it's bone, it's cartilage, it's muscle. It's not very sexy, it's not very thrilling. It's not until around Lecture Unit 2 that you start to learn about more systems and how they work with each other. It's just the bare bones. I'll be here all day. You will also learn about microscopic anatomy. Most of our attention will be on the gross anatomy. And it's not like our way is the best way, systemic versus regional approach. It's just typically a more gentle way to learn anatomy. One system at a time. We have to go through layers. Just like Dr. Minarsik said, the anatomy change is there even if it is on a histological spectrum. So yeah, first quiz is going to be on cells. Well, guess what? Cells are made up of macromolecules that are made up of smaller units that are made up of atoms. Now, this is not a chemistry class, so you don't have to go panic over your periodic table of the elements. But we need to realize that these small entities build into bigger structures And the bigger we get, the more macroscopic we're getting. Organs, organ systems, organism. So we're gonna tackle it all. We're gonna see it all. Some of these you might prefer over others. Kara, I hate histology. Everything looks pink with purple dots in it. It's all purple dots, that's all I see. That's my job, to get you through that. Histology is a lot like going to another country. You go to another country, you get off that plane, you don't know everyone in that country. And to you, they might all look the same. But given enough time, you get to know them, and you can clearly pick out different individuals from the sea of masses, right? You can. It just takes time and practice. That sound that you hear, by the way, is our refrigeration unit where our cadaver is. And that generates a lot of heat. Refrigeration units do. Is the irony lost on you? Anyway, that's part of the reason why this room feels so much colder than our other room that we were just in. You might want to dress in layers for this room. One never knows where we're going to be. It could be, polar vortex in here, and then other days they turn off the air for some reason and we roast. So dress in layers, that way you won't freeze. We're going to go through all of these systems. And again, we're starting out with the skeletal system and then the muscular system. In your homework packet, I ask you to identify different parts of these organ systems. And I say, what organ system does this part go to? For example, there's one in your homework packet that asks you about the diaphragm. And I even caution you in the homework packet and say, be careful with this one. Tricky. Most students want to put it in the respiratory system, which is logical. It is our prime mover for breathing, but it's a muscle. So technically it goes into the muscular system. Also in the homework packet, I asked you, what body cavity will you find these structures in? Ventral body cavity, dorsal body cavity, and then we get more and more specific. And again, the diaphragm, you have to be careful with that one because it divides two different body cavities. And that's why I say be careful with this one. It divides the thoracic cavity from the abdominal pelvic cavity. That's the major landmark. It's the border for those two cavities. We'll talk more about cavities as I keep going through these slides. So a lot of these organ systems you're not going to get to until later on. And for each lecture unit, I try and group some of them that work with each other. For example, cardiovascular system. I actually group into that the respiratory system. Why would I do that? Well, your cardiovascular system is required to pump your blood. Blood vessels are the conduit, the freeways, if you will. One of the places we have to get our blood to is to our lungs. And it's one of my favorite things to do in homework packets, where I say, trace the pathway of XYZ. Doesn't it sound cool that eventually you will be able to tell me how this molecule of oxygen goes through every part of your respiratory system into your lungs, crossing through the respiratory membrane, into your blood, and then I say to you, now get that molecule of oxygen to the muscle in your pinky toe, which means you got to get that blood back to the heart, through the blood vessels that go down to your pinky toe. fun? Or I might say, take carbon dioxide from your earlobe, get that gas back to your heart, back to the lungs, and get it out of your body. Name every structure you will pass. That's awesome. See, if I gave this lecture before our break, half of you would not have returned from the break. Like, I'm going to petition somebody else's class. Forget this. Yeah, well, don't worry. I will help you through all that when the time comes. So some of these systems are a lot more exciting than others, and I will teach you how we best use them all along the way. There's a reason why the reproductive system will be last. I got to know you better. If I started out with that, some of you might go home and go, not for me, scary stuff. Which is reminding me of another student that was going through a divorce because he realized he was gay, which is fine. But when I got to the reproductive system, he had a lot of questions. And some of them I wish he wouldn't have asked. I'll give you an idea of how these questions went. Yes, Andrew. So you know when you're watching a porn, that's how they all started. And all girl school, like, sure, yeah, what about it? Well, when they had the cum shot and the guy's ejaculating 3 feet off into the distance, what muscle do I need to work out at the gym to make that happen? Which immediately made me go into my party zone in my head, entertaining this idea of him doing lifts at the gym like this. And I'm like, oh, I don't think that's a muscle you can work out at the gym. I think that's a special effect where someone's in the background with a turkey baster shooting something across the room. It was fun. It was fun. I had to look some stuff up to answer his question, because you know when you're watching porn? Sure. I also remember one of his questions. He said, so is it true that if I drink a whole bunch of pineapple juice, my ejaculate, and he didn't use the word ejaculate, I'm trying to be clean, my ejaculate will taste fruity? And the smart aleck in me, I just can't help myself sometimes. Like, you can drink all the pineapple you want. It's not turning it into a pina colada. No. It is not. But isn't it true that it can change the consistency? And people said, you know, when you eat asparagus, your urine smells like asparagus, doesn't it? Well, what about ejaculate? I said, well, actually, I can tell you that there are animals that have a seasonal diet. True. Fact. And yes, their ejaculate, the consistency of it, does change. That's true. That's factual. Now, don't do it here. But how would you enter that question into a search engine?
On somebody else's computer.
And what do you think you're going to find? Because I innocently actually typed in that, and there was a lot of X-rated stuff that came up. And Honey came into the office and he's like, ooh, what are we doing tonight? I'm like, I am doing research here. Turns out you got to be very careful how you enter things for a search engine, because I then realized I should just go to the National Institute of Health, National Library of Medicine and then enter it into their search engine, because then I'll get reputable science papers. It wasn't as fun. That's for sure. Yeah, don't do it here. There are very specific terms we have to use to make it clear as day where we're looking in someone's body. If I said your stomach is on top of your bladder, how does that change if you're laying down? That's not very clear. And plus, someone would start looking down here for something right on top of the bladder, right? That doesn't make sense. So we have to use very specific words. This is the language of the discipline that I warned you about. And with a little practice, and you'll get it today, that's why it's so important that you're here today. With a little practice, it'll be, oh yeah, Kara's is proximal distal, superior, inferior, anterior, posterior. And you'll just rattle those things off, and you will quickly realize how much easier it makes learning about a particular bone. It will make it easier if you just master this language first. So anatomists realized that this could create a problem, and they said, well, we need a universal way that everyone will adhere to when we speak about the body using these terms. We need a position that we need to envision the body in. This is called the anatomical position. Even if your patient shows up prone, face down, twisted up from a car accident, in your head, you have to basically iron them out and put them back in this anatomical position. When healthcare providers fail to do this seemingly easy task, that's when we start amputating the wrong limb or taking out the wrong kidney. That's a problem. And you think your doctor would know that. It's day one for any anatomy class, this universal anatomical position. So let's learn it now. That is not it. Anatomical position. Even if your patient does not show up like this, you have to envision them standing upright or laying upright in a supine position. Palms facing forward at their side, the arms are by their side. Thumbs are out, they are the most lateral part. We'll talk about these words. And their feet are forward. This is the anatomical position. This is what you have to think of to figure out, is it the patient's right arm that we should amputate? Yeah, it's always the patient's right, the patient's left, not yours. It's theirs. It's such a simple thing, and yet we still have the wrong organs taken out and the wrong side amputated. Planes. When we look at histology of different organs, it matters what plane we're looking at. What would a garden hose look like if you chopped it a little bit at a time? Are you seeing a series of holes like this with some rubber around it? How would it look differently if you slice through it longitudinally? Are you picturing something looking U-shaped and very long? That changes if it's a different perspective, a different cut through the body. Okay. So Marie Antoinette, do we know her fate? What was her fate? She got her head chopped off. She was beheaded. So what kind of plane do we use? Transverse. Transverse cut will separate top from bottom. superior from inferior are the better words to use. So she had a transverse plane here. Most of her was inferior to that. What about Van Gogh? He was interesting character. Actually lecture on him quite a bit in physiology. Yeah. Who knew that you'd get an art history lesson? What did he do? Cut his ear off. Sent it to a woman to profess his love to her. A little heads up, flowers are better. So what kind of cut was that? Sagittal. Sagittal will split right from left. If you have a mid-sagittal cut, it is a perfect cut through your body. You will have equal halves. If it is parasagittal, para means next to, off-center. His was clearly a parasagittal cut, cut off his ear. The rest of them was on the other side. What about coronal? Coronal is going to separate front from back, anterior from posterior. Another word we can use for anterior is ventral. Another word we can use for posterior is dorsal. Those terms are interchangeable for us. But they are not interchangeable for a vet. They're not. Especially if we're talking about four-legged creatures. Anterior on a dog is typically where we pat them on the head. That's the front of them. Posterior, back here. When you give them a belly rub, that's ventral. Ventral means belly. And when you stroke them along their back, that's dorsal. You've heard of sharks having a dorsal fin, right? So for other animals, anterior, ventral are not synonyms, but for us, they are. Posterior, dorsal, synonyms for us. But in a vet clinic, those are not interchangeable. Let's see. So coronal is going to separate anterior from posterior. More terms. We've gone through anterior and posterior. Synonymous with ventral, anterior, dorsal, posterior. Superior means closer to the head. Inferior, away from the head. That's what they mean. Proximal, distal. Well, those are a little tricky. Those are a little tricky. Proximal and distal are terms to relate where things attach to your main body. See, we say axial and appendicular. Appendicular, your arms and your legs. Don't they attach to your axial skeleton? Yeah. Where does your arm attach? Up here. So if I'm closer to the attachment, say proximal. If I'm further away from the attachment, say distal. Your elbow is more proximal than your thumb, isn't it? Point of attachment. You gotta follow it all the way up. And when we use these words, they don't just stand alone. Let me give you an example. If I say, your chin is superior, that does not make sense to an anatomist. It has to be referenced to something else. There has to be something else to go with it. If I say your chin is superior to your sternum, oh, then if you know where your sternum is, you're told, look up, somewhere higher, closer to the head. So they're not used with standalone anatomy. You're comparing one structure to another. Medial versus lateral. If I say your eyes are lateral, you should say to what? Compared to what? I could say to the bridge of your nose. Lateral means away from the midline. Away from the midline. But what's more lateral? Your ears or your eyes? Ears. They're further away from that midline. So again, we got to compare one part of our anatomy to another. Prone versus supine. Supine, face up. Prone, face down. How do you sleep at night? Are you prone? Are you supine? Are you a side sleeper? Some people they sleep on their bellies. That'd be prone. Some people, no, they're back sleepers. Babies should be back sleepers. They're supine. But there's also a quirky part of your anatomy in your forearm where we can say pronation, supination, pronation, supination. Supination means we're getting back to the anatomical position. If I pronate, this is not the anatomical position. Good? I remember when my youngest child, who's 16, he's such a jerk. He will do jail time. It's not a question of if, it's when. When he was younger, came up to me one day. Mommy, look what I can do. I went, oh, good job. You pronated your arm, your forearm. Went to preschool the whole day. Look what I did. And the teacher, she always rolled with it. She never knew what kind of person he was going to be that day. Many times he'd wake up with some sort of accent, and he'd stick with it. He would not break character the whole day. I'd drop him off at preschool, and hello, like this is who we are. Apparently, we're British, which wasn't a stretch for him. My honey is British, but he doesn't have an accent, so I don't know where Matt got it. I always wanted to marry someone from another country so I can learn another language. Should have been more specific. What a flaw in my thinking. Okay. All of these terms are found in your textbook. Your textbook has handy-dandy little charts. Chances are, for a lot of homework questions, you can just find some of these charts and be able to answer a lot of questions without having to read through all of the paragraphs if you're cut for time. It's not what I recommend, but you can. Caudal versus rostral. Caudal means rear tail end. Did you know you have a horse's tail in your body? Did you know that? Yeah, you do. Do you also know that you have a seahorse in your body? Yeah, some of these terms, when we actually start to pick them apart, anatomists gave them these terms because of what they looked like, reminded them of different animals. Yeah, cauda equina. Cauda, tail. Equina, horse's tail. Yeah, horse's tail. Hippocampus, amygdala. Those all have meanings to them, and it helps, I think, in anatomy a little bit easier to learn. Okay. Regional terms. Many of these are on your lab hit list. So let's just stick with the lab hit list instead of me going through all of them. Thoracic region. That's this area where your lungs would be found. The diaphragm marks the difference between thoracic region and abdominal region. So this is thoracic region. Let's see, what else do you have? Abdominal, I just did. Pelvic, lumbar, okay? Pelvic, down here. Put your hands on your hips. Putting them basically in that pelvic region. Some textbooks merge abdominal with pelvic, and they'll say abdominopelvic. They're basically talking about this whole area then, below the diaphragm. Lumbar. Okay. Lumbar, specifically down here, your lower back, where you would find lumbar vertebrae. So it's not your entire back, it's lower, down here. What do lumbar vertebrae look like? When you look at them, they look like they are a moose. No? They look like a moose. Versus vertebrae that are found in your thoracic region, they don't look like a moose. They look like a giraffe. Come on. What's different? Giraffe.
Yeah, no, very much so.
Versus
Moose.
moose.
Yeah, I see it.
Cervical region, higher up. Cervical, those vertebrae are your snakes. Split, forked tongue, bifid. See?
It's hard because you can give cervical or cervix when we say cervical. You know what I mean?
I understand.
Yeah.
That's why
It's hot.
referencing
Yeah.
is important. Next, we have gluteal, sacral. Okay, well, sacral is lower, down here, where you might say your tailbone would be found. But it's actually not the tailbone specifically. That is your sacral. That's your sacral region. Gluteal. Butt cheeks. It's gluteal. Get a lot of shots in the gluteal region, don't we? There's a safe place to get those shots, and there's a not so safe place to get those shots. If someone doesn't know what they're doing, there's a big nerve that runs out from this gluteal region called the sciatic nerve. And it's about the width of a broom handle. It's a big collection of nerves. You want a needle going through that? Because it will send pain messages up to your brain even after that needle has left your body. These vertebrae have cushions in between them. If you look at the skeletons at the back of the room, you can see those gray discs between. Those can bulge. They can rupture. Have you had a herniated disc? Those discs can press on nerves, and it causes a lot of pain. Even though you physically are not being burned, that's how it usually is described by patients. They feel like their arm or leg, depending on where the bulge has happened, is on fire. Can you imagine having that all? Or some people say it feels like someone took sandpaper and has rubbed off my skin. It feels raw. They don't even want you to look at their skin because they feel like that makes it hurt. Yeah. So these bones that you're learning can compress on nerves. And when that happens, your brain is getting constant pain messages. You're living with that all the time. Herniated discs are extremely painful. It takes a long time for them to get back where they should. Let's see, what else? Inguinal. Inguinal, down here. If you were to put your hands in your pockets, they probably would rest on your inguinal region. And this is where your inguinal canal would also be found. This has clinical importance because, can you imagine your intestines going through the inguinal canal and protruding in a place they should not be? That's called an inguinal hernia. This happens in men because their testes develop in their body cavity, in their abdominal cavity, pass through the inguinal canal to descend into the scrotal sac. And that passageway can remain patent, open. And it's not hard for the intestines to just loop their way through there and have their intestines in their scrotal sac. This is very common, like I said, in men, but specifically boys, young boys, because that passageway, well, heck, they were just developed, right? Still open and patent. So if you have a young toddler, male, and they are humping everything in sight, every piece of furniture, grinding up against it, it's not that they're a horny, sick bastard. They have probably an inguinal hernia, and that releases the pain. So don't think like, oh, he takes after his dad. Take him into the doctor. That's not normal. Just saying. There are other ways to have hernias where your intestines actually come through the abdominal muscles. This is more common in women who have had a lot of pregnancies because their abdominal muscles have been stretched. And it's not hard for that intestine to kind of get out through the muscle fibers. And you can kind of see that intestine just underneath your skin. That's kind of crazy. I actually had a student that had one of those. Didn't know she had it. When I was done talking, she said, do you think this is it? I went, that's exactly it. Look, everyone. That's exactly what it is. Axillary. Axilla. Did you remember to put your deodorant on your axillary fossa today? So, care to guess where that is? Armpit. Yeah, of course. Brachium. Have you broken your brachium? No, probably many of you have not. It's up here. Arm. This is your arm. I know. Most of you, up until that moment, thought, this is my arm. Brachium. This is your forearm. Antebrachium. Before the brachium. Okay, so alacrinal, carpal, alacrinal. Many of you are using your alacrinal process right now. Elbow. Carpal. Carpal bones are in your wrist. It's really weird. This is where they're found. Here. Where do you wear a wrist watch? Not on your wrist, you don't. Isn't that weird? How many of you wear your watch here? Because that's where the carpal bones are. Most of you wear your wrist watch on your forearm. Why don't they say that in the store? I need to buy an antebrachium watch, please. A what? Try that one next time. That'll be fun. I see that you call these wrist watches, but no, they're anti-brachial watches. I'd like to see your official wrist watch, please. Oh, it's so fun to mess with people once you learn these terms. It's fun. Okay, what else? Palmar. Palm, good. Digits. You've got 10 here, but you also have 10 digits off of your feet, right? So if I say digit, show me digit number 1, you all should be like, where are we talking? The hand or the foot? 5. That's where if someone sits on your lap, they're usually sitting, right? On your thighs. Curl. That's your leg. I thought all of this was my leg, Kara. Nope. Just like you thought all of this was your arm. No. See how dangerous we become now? You're educated. Curl, leg, is this part below your knee. Who knew? So did you break your leg? Have you broken your leg? My mother-in-law broke both her tibia and her fibula. Rogue waves. Swept out her feet. It was awesome. My youngest one, more of a smartass than I am. Mom, Grandma's foot flopped back and forth in the waves. I'm like, don't describe it like that. That's what happened. Sural. Well, that's the back posterior part of your leg. That's where your calf is. Patellar. Patellar region, your kneecap. That's the anterior part, right? But the posterior part is popliteal. Popliteal is back here, behind your knee. Feel it. You know what's in there? It's actually mostly fat. It's just filled with fat back there. So I want you to say from now on, when you're saying to someone, I'm going to go to the gym. Oh, really? What are you going to work out? My popliteal fat? How does that look? I work out my popliteals. Burn off some of that fat. Okay, did I go through them all now? Plantar. Okay, this is a good one. Plantar. If you point your toes to the ground, we say you are plantar flexing. So it's referring to the underside of your foot. If you flex your feet, we say you are dorsiflexing your feet. So these things mean different things to us. Plantar flex, dorsiflex. To the ground, underside. We went through them all now? Okay, we're good. Well, I don't need to go through the whole table, but you might find this table useful as you approach your homework packet. Your homework packet also asks you to put certain organs in body cavities. Posterior cavities, it's weird, but your posterior cavities, we have a cranial cavity and we have a vertebral cavity where our spinal cord travels through. These cavities are enveloped by bone, our cranial bones, bones of our vertebrae make. Look at this. Some of you have vertebrae that are attached in on a string. If you actually look at them in alignment, it creates this cavity that your spinal cord travels through. That's the vertebral cavity, and both of those are posterior. Anterior cavities, ventral cavities, well, we've got thoracic, we have abdominal pelvic, we went through that. But the thoracic cavity can be further broken down even to smaller cavities. For example, there is a cavity lining around the heart. That's the pericardial cavity. There are cavities around each lung. Those are called pleural cavities. And then there's the space between your lungs, but superior to your heart, called the mediastinum. And in your homework packet, I ask you, what structures would you find in the mediastinal cavity? Now, some of these cavities, like the pericardial cavity and the pleural cavity that I just highlighted, there, for lack of a better term, because we're just learning, there's wrapping around them, like packaging. There are 2 layers to this wrapping. So if I use this bag to wrap around my hand, do you agree there's part of the bag that touches my hand? Then there's air, and then another part of the bag that isn't physically touching my hand, is it? So it's layer, space, layer. Okay? Layer, space, layer. Okay. This space in this bag is not very big when I hold it like this, is it? It's more slit-like, thin. But does it have the potential to get bigger? It does. Layer, space, layer. The layer attached to the surface of the organ is visceral. The space is the cavity. The next layer, outward, is parietal. So you have membranes around your heart. Those are called pericardial membranes. They are serosal. Well, what in Sam Hill does that mean? These membranes produce a fluid. It is a lot like plasma, but not identical. The serosal fluid made by these membranes help to lubricate the organs they are enveloped. It reduces friction. With friction comes heat. And as your heart is beating and twisting, you would not want it to rub up against these membranes and create heat. You'd cook your own heart. So these serosal membranes, they put the fluid in the cavity. That cavity is just a slit-like space. Not a lot of fluid is there. A little bit goes a long way. But sometimes people get inflammation in these membranes, and the serosal fluid is compromised, and they will feel the frictional rub. They will feel every time their heart is beating because it scrapes on these membranes because there isn't enough lubrication. Breathing, same thing. The lungs have the same setup. Membrane, space, membrane. Visceral pleura, pleural cavity, parietal pleura. Sometimes the membranes can make too much fluid. And that is a problem because now it compresses, say on the lungs, and we have a hard time breathing in. Too much fluid in the pericardial cavity can also be a problem because now it's compressing on the heart and it can disrupt the electrical activity of the heart. Visceral, tightly adherent to the surface of the organ. Space, cavity, then parietal. I'm going to take a guess here. First of all,
Yes.
are you in my class?
Yes.
You're sure?
Yes.
What's your name?
Sure.
No, I don't think you are.
Yes, I am.
Street?
This is 221. From 7, or from 5 to 6, or 5 to 5:50. And then 7 to 9:50.
7 to 9:50. This is 221.
No, 5 to 5:50, and that's 7 to 9:50.
I understand. 221 is this class.
Yes.
This is where you have your lab. You're looking for your lecture, which is 222.
Okay, thanks.
I've been here a long time. I know how this happens on the first day. Abdominal cavity. Still, we have these membranes tightly adherent on our intestines. We don't think of them moving like our heart or our lungs, but yeah, they are churning the food that we just ate. They move. And again, that abdominal cavity, the membrane that's tightly adherent to your intestines, visceral peritoneum. Space, peritoneal cavity. Get used to that. It's going to be like this. They probably are late because they were looking for parking. Bet money on it. Then parietal peritoneum. That is the membrane further away from the organ. Does that make sense? Okay, so these membranes have a cavity in between them, and they are serosal membranes there to reduce frictional rub. Depending on the doctor, if you're going to be working in the operating room, depending on the doctor, they might want to take the abdominal pelvic cavity and explain it as right or left upper quadrant, right or left lower quadrant. Basically, 4 squares. Some doctors like to create like a tic-tac-toe. More squares, smaller space, then you're more specific about where you would find a certain organ. So hypochondriac, hypo, below, chondrios, cartilage. They're talking about this space below the cartilage of your rib cage. Umbilical region, that's where your belly button is. Lumbar regions, we talked about that. That's the lower back right here. Then we have iliac region. Well, we learned about our pelvic region. And one of the biggest bones in your hip bones is the ilium. When you put your hands on your hips, you're putting it on your ilium. Don't put your hands on your ilium in front of me, little miss. See, it's kind of fun. No one will know what you're talking about. And then hypogastric, below the stomach region. Does not like when it's right?
People say that, don't they?
Yes.
Being a hypochondriac, and like, this really makes sense.
Okay, so here's our joke. And you'll hear me say it a lot. In anatomy, there is always, it seems like, more than one term you could use. And the joke is, except for when there's 7. Yeah. Some things have multiple names. It will drive you nuts because I will list both in your lab manual and you'll say, which one do I need to know? Oh, I'm putting them both there for a reason. Well, which one should I put down on my test if you tag it? I'll accept either one. I know my terms. It's okay. The reason why I put both down is spelling counts. And you might choose to take the term that's easier to spell. Good? Okay. All right. Have a little break. Stretch your legs. When you come back in 10 minutes, we're going to learn about the femur and the tibia probably fibula as well. Okay? Lower anatomy is much easier. We're not going to start with the brain. It turns out you have too many holes in your head. Those of you who need an ad code for the discussion section, please feel free to come up and talk to me. Let me stop the video.